So good afternoon to all of you. Today I would like to pay my respects to our Honorable Governor Sir, His Excellency Shri Vijayashankar ji, for accepting our invitation to launch today's campaign, which is launched across the nation by our Honorable Prime Minister. So this is and also I would like to also welcome our Additional Secretary Hekali ma'am and also my colleagues who are here, Mr. Vidya Tiwari, Commission Secretary to Honorable Governor, and also Commission Secretary Health Dr. Juran Beda, and all the senior officials who are here, including the Directors of Health Services, and also most importantly the entire health team and also social welfare team. Both of them here, especially represented by especially our Ashas who have come from different districts. So I think you all have the privilege, and we are all fortunate to hear about the message from our Honorable Prime Minister about today's program. And just like I think you all aware, but we wanted to tell you a few things like how actually we are going to celebrate in our state in Meghalaya. So like all other states, in Meghalaya also, for the next 2 weeks from today to 2nd October, we are going to have the camps and a lot of campaign all over all the entire state. All the health facilities, both public health facilities as well as the private health facilities, will actively engage in this work. Some of the things, as I think you are aware, Meghalaya has brought its own state health policy. Meghalaya brought state health policy has 3 dimensions. One of the important dimension is preventive health policy. So this campaign is actually in achieving that policy. How important it is to really go proactively for screening and see that in fact I really appreciate, I really like whatever the Prime Minister has mentioned, asking every woman to go and get screened. This is something you should not have any hesitation of going for screening. Screening is very important. The reason is that if you go for proactive screenings, proactive diagnosis, the advantage is that we can actually understand the problem at the earliest, and also we can actually address the problem more effectively. I would like to give one example about this one, during this particular campaign. A lot of screening will happen for the cancer screening, both breast cancer and also the cervical cancer. So which both are very important for women related. So these are all the things actually we need to really go for it. In fact, it actually helps us. In fact, if there is a early signs, for example, for cervical cancer, if there is any HPV infection, if you find, we can actually address that one. It will not lead to cancer. So it's a very important thing. This screening is such an important thing. I request all our, all our entire state, all the district teams, block teams, and everyone should proactively encourage and go for the screening. This is a very important thing. Besides that, we also actually wanted to focus on the focus is also on anemia reduction. In Meghalaya, we wanted to really address the anemia. So there is a lot of focus. We should go for screening of anemia. And then and also a lot of campaign about anemia reduction, like a lot of how the state government has introduced very effective, ferrous ascorbate IFA tablets, which are very, very effective in terms of iron absorption. We should also propagate during this campaign how actually our mothers and our in fact children are taking this IFA tablets, which are given for right from the children to the pregnant mothers to everyone. So this is another important we are going to put a lot of focus upon. Besides that, there will be a lot of engagement from the social welfare side also, department side. This entire period will be used for portion, especially nutrition. We need to improve the nutrition. There's a lot of nutrition education has to happen during this entire program, and involving the women and also the adolescent girls. Besides that, we are also We're also going to involve the self-help groups. In fact, Meghalaya has a large number of self-help groups are there, 50,000 self-help groups, in fact covering about 92% of the rural households. So all the self-help groups should be involved. In fact, they can be mobilized for this active, the campaign, and so that we can really see the kind of a change that really we wanted to see. Besides that, we also have launched, as you are aware, as part of state initiative to reduce stunting in the state, because Meghalaya has a stunting problem. 46.5% of the children below 5 years are stunted. So to address the stunting problem, a statewide launch has been done for especially teaching mothers and the parents about the benefits of effective breastfeeding. So in fact, that's where we are not really doing well. So especially effective breastfeeding, there are IIT Bombay, they are actually organizing trainings to almost all the workforce from 3 departments: health department, social welfare department, community and rural development department. All the departments are put together. They're actually, in fact, yesterday they were writing some exam so that they can teach well. So sir, actually this is something, a massive program that we are doing, that also should be continued during this period, this campaign, so that our children and mothers actually will be able to, and especially if you address stunting and anemia at the child stage, it will not actually percolate at the adolescent stage. So these are some important priorities that actually state has. So I request in fact to all the participants and on this occasion, and also taking the presence of our Hon'ble Governor, I would like to request all of you that let us make this entire campaign as a good success, and we should actually really get good results out of this campaign. With this, I take leave. Thank you very much. Bless you.
The Additional Secretary from Ministry of Health and Family Welfare, Ma'am Hekali Zimomi. I request you, ma'am, to kindly deliver your speech, ma'am. Thank you.
The Honorable Governor of Meghalaya, Shri C.H. Vijayashankar, Commissioner and Secretary, Health and Family Welfare, Dr. Joran Vela, Principal Secretary, Mr. Sampath Kumar, the Commissioner and Secretary to the Governor, Mr. Brahmadev Tiwari, senior government officials, the health team, and the team from the Social Welfare Department. I'm extremely privileged to participate in the launch of the Swasth Nari Sashakt Parivar campaign in the state of Meghalaya. This campaign is a nationwide health and nutrition initiative and is a testament to the government's commitment to placing women at the core of healthcare strategy, which is a crucial step towards building a Viksit Bharat. As we all know, women play multiple roles, and we carry out economic and domestic responsibilities, and consequently, there is a tendency for women to put their families and others ahead of themselves. And so this campaign focuses on bringing women and adolescent girls to the forefront in terms of accessing healthcare services. So the fundamental philosophy of Swasth Nari Sashakt Parivar campaign is that the health of a woman determines the health of a family, which in turn determines the health of society and the nation. And therefore it is important to ensure the health of women. So women's health, development and empowerment are the key priorities for our Honorable Prime Minister. And with this campaign, a comprehensive and integrated approach is being adopted to ensure the health and wellness of women and children by focusing on screening, early diagnosis and treatment, as well as addressing lifestyle issues and focusing, of course, on preventive care. The focus is also on promoting healthy food habits, particularly the reduction of the use of oil, salt, and junk food, so as to prevent obesity. And as if you just heard the Honorable Prime Minister speak very passionately, and I hope that the state government of Meghalaya, as well as all the members of the health team, of the health department, will really reach out to both women in both urban and rural areas so that they can respond to the Honorable Prime Minister's passionate plea to ensure that every woman, every adolescent girl comes and avails of the health services that are being provided during the 2-week campaign. So this campaign would see the converging efforts of the Ministry of Health and the Ministry of Social Welfare, as the nation also celebrates the 8th Nutrition Month, the Poshan Month that is celebrated every year. And the focus, of course, would also be on nutrition. So the Swasth Nari Sashakt Parivar is the country's largest outreach camp of its kind, which focuses on women. And as has been pointed out, the focus would be on antenatal care, would be on NCD screening, a particular focus on cancer screening for women, for breast cancer and for cervical cancer, TB, sickle cell disease, etc. And the country would see more than 1 lakh health camps across the nation being held from 17th of September to the 2nd of October 2025. And the Hon'ble Governor, it is a privilege to be here, and I can only say that there couldn't have been a much more befitting place to launch this program than in the highest office of the state, in a state like Meghalaya, where you have a rich tradition and a cultural heritage which places a unique position on women, a unique matrilineal society, and therefore we must focus on ensuring that a strong foundation for women is laid, empowering them so that they are able to lead healthy lives. So while the dynamics of cultural lineage gives women in Meghalaya a higher social status and economic security, the health status of the women in the state also need to be focused upon. And if you look at the NFHS data, 53.8% of women in the age group of 15 to 49 are reported as anemic. And so I'm very happy to hear the Principal Secretary stating that the focus is going to be also on addressing the issues of anemia, which is prevalent in the state. But also the focus should also be on increasing institutional deliveries. The number of institutional deliveries, the percentage of institutional deliveries which was reported in the NFHS was 58%. I'm told that it is reflected much higher in the HMIS, but 58% and HMIS 73%, perhaps I think we can do much more in a state which has such a strong tradition of empowering women. So I believe that this campaign is a timely and a significant initiative that will address health disparities across the state, both in the rural and urban areas, and particularly focusing on the needs of women and adolescent girls. The health of women is not a choice, it is a necessity. And so I hope that the government of Meghalaya will ensure a successful campaign so that women across the state can access the opportunity that is being provided through this campaign. Thank you very much. Jai Hind.
May I now invite Honorable Governor Shri C.H. Vijayashankar to kindly address the crowd.
Very good afternoon to everyone. I am so happy to participate in this program, which is being inaugurated by the Honorable Prime Minister of this country for the whole nation in the name of Swasth Nari, Sashakt Parivar. And we have been heard the speech of Honorable Prime Minister also. Before I am going to start my speech, it is a tradition, it is a culture of this land. If at all I am able to quote the words we are able to see in Bhagavad Gita, which have been told by Lord Krishna. He says very clearly, Yatra narastu pujyante ramante tatra devataha. Yatra narastu pujyante It means जो नारी को सम्मान मिलना है, जो ये नारी को गौरव मिलना है, एक नारी का आदर होना है समाज में, वो जिस जगह पर होता है वहाँ पर देवता प्रस्तुत रहता है। नारी का गौरव करना, आदर करना, सम्मान करना, ये हर समाज का कर्तव्य होता है। This is told by Lord Krishna 5000 years back. यत्र नारीस्तु पूज्यन्ते रमन्ते तत्र देवताः। नारी का पूजा करना, नारी का सम्मान करना हर समाज का एक कर्तव्य होता है। And that too particularly in case of Meghalaya, I know it is a female dominated society. If at all you are able to see, a female dominated society anywhere in any part of the country, I am proud to say that credit goes to the state of Meghalaya. The state of Meghalaya. Of course, I am from Karnataka. I won't find this kind of tradition and values. Of course, we respect women, but female-dominated society, if at all you have to see anywhere in any part of the country, ultimately we have to come to the state of Meghalaya. We have to come to the state of Meghalaya. And particularly this program, even Elkaji and Sambat Kumarji and rest of the officers of the department, I make it very clear, this program, a 15 days program, should be celebrated as a festival in Meghalaya. It should be a festival, like a festival. How we are going to celebrate festival? Likewise, only this program for 15 days program should be taken up in that way. Not only should be taken up, the man like you people, committed personalities, dedicated personalities holding the department. I know your capacity, your commitment and concern towards a common man. In that way, I tell you people, you are not going to make it only festival. You are not going to only conduct these programs in every part of Meghalaya. Ultimately, I am going to say, we have to stand number one in the entire country, taking up this program. Swasth Nari Sashakt Samaj. This program, if at all any state, Prime Minister is able to quote, I have taken the report, and if at all he is going to quote, when he is going to say, after a few months, if at all he is able to mention, you should mention the name of Meghalaya. That's the number one state who have been conducted, who have been taken up on top priority, the program being introduced by the Prime Minister today. And each taluk, a nodal officer should be there. You don't have any other job. For 15 days from morning to evening, only is supposed to take up the report and go to every place, every corner of the taluk and see that every day that report should come back to you. And each district, a nodal officer should be there. Even for state level to conduct this program, to make it successful, ultimately a state level officer should be there as a nodal officer, you very, very practically just you plan yourself. Sit whole day along with your officers. How it has to be taken up in the state of Meghalaya. So in that way, whatever the assistance you people expect from the Raj Bhavan, any kind of staff, any amount of people, if at all you wish from our side to monitor this program, 100% we assure you, we are with you in this program. And if at all you people call, sir, you have to come to the remote area of this state to monitor or to be in this program, either inaugurate or to be there with them from morning to evening. I won't mind. Even our commissioner secretary, we won't mind. If at all you say, we should also involve, we are ready to involve. We are ready to participate. We are ready to be with you. Wherever you say. So in that way, Mr. Hemant Kumar and Elkoji, you all the senior officers of the department, you just plan for it. Only namesake we are not supposed to conduct. Only namesake we should not participate ourselves. It should not be like that. It is a very sincere thinking program of the Prime Minister of this country. Why I am telling all this? Because I am very much worried, I am very much bothered after I come here to the state of Meghalaya. You see 10% of the overall, the people of Meghalaya, they are suffering from the drugs. 10% of the population, out of which 5% of the population, they are female. And AIDS is another major issue which made us to worry like anything. In that way also, wherever you conduct the program, top priority to see that drugs and ultimately how it is going to affect on the younger generation, that awareness should also be taken up there. And AIDS, that awareness should also be taken up. And TB is another issue in the state of Meghalaya. Before I come on this stage, Hemant Kumar told, when Elkaji, I asked about their age, because they are 96 batch. 96 batch in the sense almost 29 years of service. Now I feel that now you can admit them for first year or second year BA, for degree. She can go to college as a student. Seems to be like that. But the service, already 30 years of service they have given. This health should pass on it to our generation. This awareness, you have to pass on it to our generation. We should also make them to lead healthy life. Our generation, at any cost, they should not suffer out of AIDS, out of drugs, out of TB. And another major issue, I tell you, this is the major issue, is cancer. Another issue is cancer. Prime Minister told very clearly, this checkup is free, medical checkup is free, medicine is free, treatment is free. What else can be done by the government? Only thing we go and should reach Ultimately, after 15 days, we should not hear anybody is being left out. Anybody is being left out in the state of Meghalaya. All the 15 days from morning to evening, entire department should involve and should feel that we have given justice to the state of Meghalaya, to the state of Meghalaya. This is what I would like to say to you people. This is what I would like to say to you people. And I'm very proud to say today, Vishwakarma Jayanti, our Prime Minister mentioned, we can understand the commitment and dedication towards the society by the Vishwakarma Samaj. We are very, very grateful to them. That's one part. Another part, our Prime Minister did not mention. He given such a wonderful program to the nation today, that to this motherland, this program given to all women of this country, mothers of this country, sisters of this country, but he did not say today is birthday of our Prime Minister. Today it is his birthday, our Honorable Prime Minister birthday. Particularly his birthday, he decided to take up this program. This program should be given to the entire nation, to our mothers and sisters, our daughters of this country. But he never said, he never mentioned, because today is my birthday, I'm going to give this kind of program to the entire nation. He did not mention even a single word about his personal thing. But from this stage, I am going to one way, I am going to say I am really very thankful. I am very grateful to the Prime Minister of this country. We are very proud to have such a wonderful personality as a Prime Minister of this country. And from this stage, I am going to wish Honorable Prime Minister, today morning we have sent the letter through mail to the Prime Minister wishing birthday wishes. From this stage, I am going to wish the Honorable Prime Minister very, very, very happy birthday to the Prime Minister of this country. So, I think some of the things they have given it in writing here, and I don't want to mention all those issues. This is, let us take up this opportunity to ensure that all women and children and all our saint girls in our families and communities benefit from these services. And I have been, because of my age seniority, I have no any other, I think, feeling in my mind. Definitely I say, you see, if at all in case of AIDS, in case of cancer, in case of TB, and suffer out of anemia, and Sampath Kumar also knows it very well, 90% of the child, 90% of the women, they come from the family of the broken families. Broken families. At any cost, diverse, at any cost, this kind of issues should not be continue, at any cost should not continue in the state of Meghalaya. Broken families. For such families, what we are supposed to do? What is our commitment for such families? Again, to bring back them to the normal life, to lead normal life. They have got every right to lead normal life. And ultimately, it is our responsibility to see that, being the part of the government, being the part of the elders of the society, it is our responsibility to see that again they should come back because they are our children, because they are our sisters, because they are our mothers. At any cost, they should not suffer. That should be our commitment. That should be our commitment. In that way also, we have to see that what should be our role. What should be our role for such families. In that way also, when we go for such campaign, we have to create awareness. We have to create awareness in the mind of the people, of a common man. Because I would like to see here, people are very, very innocent here. Many of them, they used to tell me, sir, you are very, very innocent, sir. Always good people are innocent, I tell you. They never harm anybody, they are being treated as innocent. They never harm anybody, they have never harmed the society. They never cheat anybody. They never cheat anybody. Such people, such personalities in this society, they are totally innocent. You see, they should feel proud of such people. They should feel proud of them. Instead of them, we used to say, they are totally innocent. They are totally innocent. No, this word, many of them, they used to tell me, even coming from my mouth also, they are not innocent, they are the asset of the society. Because they never harm anybody, they never cheat anybody, they never lie. And they are the very good human beings, I tell you. They are the very good human beings. In that way also, we have to take care of the entire society of Meghalaya. This is an opportunity in our lifetime. This is an opportunity of our lifetime to take up such issues which is making our society to go in a wrong way and suffer for unwanted things. Again, we have to bring it back. We should make it a model society because our forefathers in Meghalaya, they lived like that. They lived like that. Again, we have to bring back those colorful days in Meghalaya. That should be our commitment, that should be our motto. We pledge ourselves, we involve, we dedicate, and we take up this program to the nook and corner of the Meghalaya. Okay? Okay? We can pledge ourselves? No voice from anybody. My God. This voice should reach to the Prime Minister of this country. Okay? Yes. Now I'm very happy. Bolo Bharat Mata ki. Yes. No voice. Particularly clapping is very difficult here. And clapping, you ask health officers, it is very good for our health actually. We are going to praise somebody, encourage somebody, for that we clap. But personally we are going to benefit out of it when we clap ourselves. Whether true or not, Mr. Sampath Kumar, whether true or not, madam, yes, clapping is good for health. It actually, blood circulation, totally, when we sit for a long time, by that time blood circulation problem will be there in the body. It brings back to the normal blood circulation. So clapping, that should be there. Laughing, that should be there. And if at all anybody says with loud voice, we should say. And that too, particularly in Meghalaya, madam, if at all one speaks, it won't hear to your next man. It won't hear. It's actually good, but not all the times. Bolo Bharat Mata ki. Jai. Bolo Bharat Mata ki. Jai. All the best. Thank you so much. Namaskar.
It is my great honor and privilege to deliver the vote of thanks. It is my great honor and privilege to deliver the vote of thanks on this special occasion, marking the state launch of the Swasth Nari, Sashakt Parivar Abhiyaan and the 8th Poshan Ma in Meghalaya. First and foremost, on behalf of the Department of Health and Family Welfare, Government of Meghalaya, I extend a heartfelt gratitude to His Excellency Shri C.H. Vijayashankar, the Governor of Meghalaya, for gracing this event as the chief guest and for formally launching the landmark campaign in our state. Sir, your presence and inspiring address have not only elevated the importance of this initiative, but have also reaffirmed the state's commitment towards the health, nutrition, and empowerment of women and children in the state. We are truly honored by your leadership and your vision, sir. I also would like to make a special mention of and thank you to Sir Dr. Sampat Kumar, IAS Principal Secretary, Government of Meghalaya, for your tireless effort in ensuring the successful implementation of various health initiatives in the state and for your valuable administrative leadership. I would also like to take this opportunity to thank Madam V. Hekali Zimoni, IAS Additional Secretary, Ministry of Health and Family Welfare, and Director General of NACO, Government of India, for joining us today and for your valuable insight on the details of this special campaign, the Swasth Nari, Sashakt Parivar Abhiyaan, and for your valuable support to the state. And my sincere appreciation also to Dr. Joram Beda, IAS Commissioner and Secretary, Health and Family Welfare Department, Government of Meghalaya, for his guidance and for your leadership and in driving this initiative forward. I would sincerely thank Dr. BDR Tiwari, IAS Commissioner and Secretary, to the Government of Meghalaya, for your continuous support and guidance in the successful preparation and coordination of today's program. I would also like to express our appreciation and thank to all the senior officials of the Health Department for your presence here today. Your support and participation added significant value to the success of this program. I also extend my heartfelt thanks to all the officers and staff of the Raj Bhavan for your support, cooperation, and seamless coordination, which have greatly contributed to the success of today's event. I would also like to extend my deep appreciation to officials from the Department of Social Welfare, Education, the Meghalaya State Rural Livelihood Society, for your presence here today, and your department play a very critical role in supporting the health and empowerment of women and children, and your collaboration is essential in ensuring the success of this campaign. A special word of appreciation also goes to the Village Health Council members, who are the true pillars of the community and are dedicated ashas who remain the backbone of our health outreach. Thanks also goes to our staff from the NHM, whose tireless effort and behind the scenes dedication have made today's program a success. Your hard work is deeply appreciated and does not go unnoticed. I wish to extend a sincere appreciation to the media fraternity, both print and electronic, for your presence and for helping us spread the message of this campaign far and wide. Your role in building awareness is deeply valued. Lastly, I thank each and every one of you present here today for your participation and for being part of this important journey. Let us move forward together to ensure that every woman and child in Meghalaya has access to quality healthcare and nutrition that they deserve. And finally, if I have inadvertently mentioning anyone by name, please accept my heartfelt thanks. Your contribution, big or small, has played an important part in the success of today's program. Together, we can build a healthier woman, a stronger family, and a healthier Meghalaya. Thank you once again. Jai Hind, Hubley, Chibon, Mithela.
Thank you, ma'am. We will all rise for the national anthem.